ಆಸ್ಟರ್ ವೈಟ್ಫೀಲ್ಡ್ ಆಸ್ಪತ್ರೆಯ ಹೊಸ ಅತ್ಯಾಧುನಿಕ ಇಂಟರ್ನ್ಯಾಷನಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ನ್ಯೂರೋಸೈನ್ಸ್ ಮತ್ತು ಸ್ಪಿನ್ ಕೇರ್ ವಿಭಾಗದ ಉದ್ಘಾಟನೆ. ಆಸ್ಟರ್ ವೈಟ್ಫೀಲ್ಡ್ ಆಸ್ಪತ್ರೆಯು ಅಪಸ್ಮಾರ ತಡೆಗಟ್ಟುವಿಕೆ ಮತ್ತು ಸಮಗ್ರ ಆರೈಕೆ (EPIC) ಎಂಬ ಸೌಲಭ್ಯವನ್ನು ಆರಂಭಿಸಿದೆ. ಇದು ಆರ್ಥಿಕ ಅನಾನುಕೂಲವಿರುವ ಗುಣಪಡಿಸಲಾಗದ ಸೆಳೆತದ ಸಮಸ್ಯೆಯಿರುವ ರೋಗಿಗಳಿಗೆ ಪ್ರತಿ ತಿಂಗಳು ಉಚಿತವಾಗಿ ಶಸ್ತ್ರಚಿಕಿತ್ಸೆ ನೀಡಲಾಗುತ್ತದೆ. ಇದರ ಉದ್ಘಾಟನೆಯ ಸಂದರ್ಭದಲ್ಲಿ ದೇಶದ ಹೆಸರಾಂತ ಮಾಹಿತಿ ತಂತ್ರಜ್ಞಾನ ದಾರ್ಶನಿಕ N R ನಾರಾಯಣ ಮೂರ್ತಿ ಮತ್ತು ಆಸ್ಟರ್ DM ಹೆಲ್ತ್ಕೇರ್ನ ಕಾರ್ಯನಿರ್ವಾಹಕೇತರ ನಿರ್ದೇಶಕಿ ಡಾ. ಝೆಬಾ ಮೋಪೆನ್ ಹಾಗೂ ಆಸ್ಪತ್ರೆಯ ಪ್ರಮುಖ ವೈದ್ಯರು ಹಾಜರಿದ್ದರು.
Among our world-class facilities stands Aster Whitefield, today's star. Our third multi-specialty hospital in Bangalore, which stands as a top-tier medical institution in the city. With a strong focus on delivering world-class, patient-centric environment, Aster Whitefield aspires to continuously raise the benchmark for high clinical standards, quickly becoming a key player in Bangalore's healthcare landscape. While I can stand here as a proud Asterian and continue sharing about all the different parts of our story that we are so immensely proud of, I think what we are inaugurating today and launching today is a perfect representation of Aster's core values.
Now, it is very well known, you must have seen the glimpses of the technology behind you. Any surgery, especially neurosurgery, is an art as well as science. Now, apart from knowing the science well, if you have to deliver top-notch results in neurosurgery, it was erstwhile considered to be a specialty, very morbid. People still carry that notion. They think it is a very morbid specialty and you don't come out of a surgery. Now, a neurosurgeon is like an artist, and a good artist needs his tools. That's what you saw in the corridors around us. And this inaugural event, apart from inaugurating the department, also marks the arrival of the state-of-the-art tools, including the kick and the curve navigation systems, which you will see on the left in the corridor, a Lupex, which is a robotic suite, which helps us in the accuracy in performing spine surgery very fast. And we also have a 3D reality tool which Mr. NRN himself experienced, and also the biplane high definition neurovascular suite, which we are going to start operations in probably a week or two.
With that, introduction, I will put this epic program in front of you to bless us more and to do more. And whenever I do this, 3 people come into my picture. Those 3 people are 3 women. 2 of them are not in front of us. They lost their own life, and they lost their life because they couldn't cope up with epilepsy. Both of them, one was at the age of 19, another was 23, and both those 2 patients I was treating for more than 7 years before their marriageable age, and after the marriage the other family got to know they had an epilepsy. Typical of India, we make a big stigma about epilepsy. The people did not tell them they were on medication, and the other family got to know about it, and when they were taking a medication in a newer family when I had an epilepsy, 2 families fought together, and my 2 patients had to take their own life. This is the unfortunate thing, and that is the one which instigated to me, saying that whatever the surgeon you are, whatever the education you are, if you are not taking the public view into consideration and make that bigger, I'll not be a surgeon and not be a doctor. And that instigated me to do this program 4 years ago.
Well, Professor Satish Rudrappa, Dr. Moopen, Professor Swarup Gopal, Shri Satish Madhavan, and Shri Nagesh. I am indeed honored to be part of this noble endeavor by Aster and by Rotary International. it was Louis Pasteur who said, when God is shy to announce His presence, He comes in the form of chance. A chance that gave birth to Satish, a chance that he grew up in a highly cultured family, a chance that a very successful expert who had all that he wanted in the United States to decide to come back to our country, and a chance to take up neurosurgery. Therefore, whenever I meet people like these wonderful doctors on the dais, my energy, my enthusiasm, and my confidence in the country goes up, because there's so many reasons why you could be frustrated. I don't want to go into those details, but it's very easy to get frustrated. But what brings back that energy, that enthusiasm, and that confidence is meeting such people.
It's an incredibly proud day for us. We have launched the Aster International Institute of Neurosciences and Spine Care. Besides that, what we are most proud of perhaps is our collaboration with Rotary International to launch the EPIC program, the Epilepsy Prevention and Integrated Care program. Aster's mission has always been the marriage of excellence with service. And today, with the inauguration of our Neurosciences department and the launch of the EPIC program, this is a great marriage in our mission of serving the community and providing accessible, affordable, and quality healthcare to all. We're very proud, we're very excited to see where the EPIC program can go. We have big aspirations for it. We really want to help this underserved community. Epilepsy is a stigmatized disease, unfortunately. A lot of people suffer in silence, families suffer in silence. It is our onus and responsibility to help these people, give them a voice and give them a solution. Very excited about this project. Aster is growing tremendously in India, and we want to take up more and more initiatives of this sort which will really help the community.
We have joined Aster about 8 months ago, and we have completed about 700 surgeries. As you have seen today, all the equipment that we have at Aster Whitefield is on display in the corridor outside. It is a state of the art. Some of the equipment is the first in Asia, first in Southeast Asia, and we are very proud to offer these equipments to our patients at a very, very affordable cost. So in reality, we have brought the Western level of healthcare to the benefit of people in Bangalore, in the state, as well as the country, and we hope we extend these facilities to our neighbors as well, neighboring states, and also in Africa and the other parts of the continent.
Today, on a Onam day, an auspicious day in the world, at Aster Whitefield, in association with the Sukriya and NGO and the Rotary International and Rotary IT Corridor we are starting a new program called as EPIC program. So the EPIC program is nothing but Epilepsy Prevention and Integrated Care program. In this program, we are doing a public awareness program on epilepsy, because epilepsy is a stigmatized one. Many epilepsy patients do not tell what exactly they have. So especially in the rural area, it has become a taboo, so that people do not come out, they don't go to school, they don't marry, they have a difficulty in communicating with the doctors, and families sometimes abandon them. To increase this awareness, we have come out with this epilepsy program, and those patients whose epilepsy is not controlled, that means they get more than 2 to 3 episodes per week, we have a program where we do free MRI, free video EEG, and diagnose where it is coming from the brain. And there is a brain surgery available as of today, where if you find out the focus from where epilepsy is starting, we can take out that part of the brain and patient do as good as normal person, and many of them can come out of the medication. And this is is done free of cost to all the below poverty line patients in Aster Whitefield Department of Neurosciences at in Whitefield. Please avail this. There is an app available called as Epic-Rotary, which is available both in Kannada and English, and we have a hotline number. Please visit our website, Aster Whitefield Hospital, and you will find the helpline number. Any epileptic anywhere in the country need our help, we are always available to you. And this is a great program for society. Please do not differentiate epilepsy patients. They are as normal as anybody, and any one of us can get epilepsy, whether children, adult, depending on the age. Anybody who has a good brain, it is just an electrical activity which happens momentarily and spreads to the rest of the brain. It is not a disease, it is a kind of a symptom. If it is diagnosed early, 90% of the patients can be cured. And those who have a difficulty, please come to us. We are always there to help you and to tell you how to get treated, how to avoid it, and if you still have it, how I can make sure with a brain surgery and epilepsy surgery, we can make you much more better.